Elizabeth Norman. I'm a children's mental health case manager with Hiawatha Valley Mental Health Center. Case management is a service that Hiawatha Valley provides to children between the ages of 2 and we'll take them all the way up to 21. They have to have a mental health diagnosis, and what we do with those clients is that we help coordinate services to help them deal with the symptoms of their mental illness and get them to a place where they're functioning in the community or at school or at home to a point where they no longer need the service. So our plan is to go in, set them up with whatever they need, and kind of teach them how to navigate through all those services. I love it. I work with a lot of teens, and I love working with them because a lot of times with teens, parents are burnt out. They've been dealing with these behaviors probably for a very long time, and once they get to teenagers, a lot of people, a lot of service providers, parents are just exhausted because these kids have usually been in and out of services, and I love being able to go in and let them know, like, I know you've been in and out of stuff, but I'm not going to give up on you. So seeing a couple of my clients graduate from high school, I love. That's huge. I had one client that really thought she was never going to graduate from high school, and she did. And then she actually went on to go to college. And I remember I had a visit with her in her home the day she got her letter that accepted her to college, and she was so excited and she was jumping up and down, and I was so proud of everything that she had done to get to that point. So stories like that always, I think about those on the rougher days. When we took on case management and contracted with Winona County in 2012, we started out with 2 case managers. I was one of them, and within a week we realized we needed a third. And since then, we've grown from that to 8 case managers. We now work within Winona County as well as Fillmore County. And I think that that's because we make ourselves very visible to schools, to therapists, to families. We let them know that we're there to help, and we connect with all those different service providers. And it shows what a big need there is, the fact that we're now serving this many families, and we need this many case managers because there's a need for it in the community. It's important work, and I think service providers like having that person to connect with and let them know, like, this might be going on with the family. Can you help facilitate that conversation with the family? We make ourselves available to people, and I think that word of mouth helps show we're getting more referrals from schools and places that we didn't necessarily get referrals from before. A lot of them came from just therapists, and now we're seeing them from all different service providers because we do connect with all of them and have good relationships with all of them. Hiawatha Valley as a whole could use tangible items for therapists and day treatment providers who kind of give that direct care. A lot of items like workbooks or interactive therapeutic games, things like that they can do with kids are extremely helpful. For case management, I think rather than tangible items, it might be helpful if we had kind of an in-house funding source that we could use for families when there's an immediate need, because there are funding sources that we do use within the community, but sometimes it can take a while when you're looking at an outside source to get the funding in place. That can take up to a month or longer to get that, and sometimes families have immediate needs. Say I've got a teenager on my caseload who just gets a job, but they don't have transportation to get to that job. If I can go to a garage sale and get them a bike for $10, you know, the same day or the next day, and they can start work right away, then that's extremely helpful for their well-being. If, you know, it helps them build self-esteem, and if we can get on it right away, then they're more likely to follow through with it, because a lot of times, as we know with teenagers, they can change from one day to the next. So if we can get that stuff in right away, then it makes them more likely to succeed, I think.